Thanks everyone for coming. So today, this is all about our identity. So this is a story about us, about BAcC members. Not only about uh, us as BAcC members now, the identity we project as BAcC members, but also about everything that's gone into building this identity over time. And I think it's a really important thing to have this discussion because we are uh, I think we're going through a point where it's really important for us to find out all the good reasons why things have been done in the past and work out what it is that's important to continue into the future. So this is something we're going to be looking at today, how the actions of successive generations and their membership fees and all of those resources have built what we have today. But first, we have to kind of realize what that is. So before we get started, this is something that everyone can play along with at home. I don't know if anyone's done this before, but if you go to the NHS website, you go to nhs.uk and you type in acupuncture, so we can do this live. And then we go to the acupuncture site, and there's a whole pile of text about acupuncture. And if we scroll down about halfway, we get to this line. So it says here, if you choose to have acupuncture, it's recommended that you check the acupuncture practitioner as either a regulated healthcare professional, such as a doctor, nurse, or physiotherapist, or a member of a national acupuncture organization. And it says you can find an accredited acupuncturist on the Professional Standards Authority for Health and Social Care website. And this is the only link that they have here. So we click on the link here and we scroll down and there's only one body. So we click on this link, search for practitioners, and it takes us directly to our practitioner website. So this is quite an amazing a thing that we have. We have a direct link, direct referral link from the NHS to the to our practitioner directory. So I think it's a good way to start because there is a question of why we're able to have that. And a lot of the talk today will be giving this answer. So this is the structure of the talk. We're going to talk a little bit about the different ideas of what the value of being a member is, the BAcC. And one of the aspects of value is our identity and the trust that that identity carries. So I'll be explaining a little bit how we build that trust because it's really important to know how we do that. And really, as you'll see, there's only really one way of doing it. There might be some slight differences around the edges, but there are necessary components of building that trust that we have to do. And if we do all those, then we can project a certain identity. And I'm going to explain what that identity is. And again, it's something that maybe a lot of us haven't actually really thought systematically about. What all the aspects of that identity that we can project to the outside world. And then a good question is well, it's all very well having this trusted identity, but what does it actually bring us? So we'll be doing a bit of an evaluation of that. And along with that discussion, we'll be asking how the PSA has actually performed for us over time. So at the end, you'll have an opportunity for questions. So I really urge everybody to think of any questions you like, and particularly ones that you think might be challenging, because this is something that should be challenged. We should really find good answers. And this is the process that I've been going through as the CEO over the last 4 months. Because I'm a CEO, but I'm also a member, and I've wanted to find real answers to these questions. And it doesn't feel good to me to give answers that aren't convincing to members. And quite honestly, if I didn't find good answers, I'd question whether I wanted to be CEO or not. So hopefully you'll see that some of the answers that we found to these questions are pretty robust, but there are also questions, legitimate questions. So the value of membership, there's lots of different ways of looking at it. And I think one way that we often start with is just, well, what do I get? What do I get from my membership? Well, we get this, we get access to private health insurers. The BAcC has the recognition with a number of different private health insurers, the largest number. We have our directory, and that directory is linked to the NHS, as we just seen, but it's also something where it's legitimate for GPs to refer. We're going to talk about a bit about in a moment. And that gets about 22,000 monthly visits. We have things like our events, our conference, our CPD, we have our magazines and our journal, Acu and eJom, our member resources, and we have real-time support. You can phone up the BAcC at any time and you can get that support and lots of discounts. And there's lots of other things as well. So these are kind of the benefits that we think about when we think about membership. There's a second aspect of membership, one that we really touched on last time quite a bit, which is what you support as a member. We have a duty, we have a responsibility in Chinese medicine to pass on what we've received over millennia to the next generations. And very much the BAcC is the only organization that's taking that seriously. It's the only organization that funds the British Acupuncture Accreditation Board and sustains education. And the BAcC does, what you'll see is that what it's done over the years is taken really sensible, clever, and respectable steps towards building something that has a very solid base and infrastructure, and that's something you should continue. But we're going to focus on the third one here because there's something that you get through membership of a body that is a voluntary regulating body. It enables you, the identity that you have. I know that everybody in this room and everybody in our membership has an ethic of wanting to do things the right way, wanting to have high standards. Otherwise, you wouldn't be in a voluntary regulating body. You don't have to be in this body. It's voluntary. But we all choose to be, and we all chose to take on 3-year degree level courses. So what you're going to see in this presentation is how we're going to explanation of how we build that trust. And through building that identity based on trust, we're going to discover that we get to project ourselves and we get recognition from organizations and stakeholders across the UK in all sorts of different spheres and across the world. And those relationships, almost two or one, only have a relationship with the BAcC and not other bodies. And we'll see why that is. And just to say that this tradition that we're passing on, if we see what we're passing on like a tree, this regulation work, this trust work is like the trunk of the tree. It's everything comes from that. It only bears fruit if we have a solid trunk. So we'll be looking at that later on as well. And I just wanted to say that it's not just about sustaining what we have. If I was to just say a few things about a possible idealized future, subsidized low-cost provision of acupuncture for all, clear, affluent career paths with continued supervision and training, state-of-the-art integrated Chinese and Western medicine recording and IT systems, all data anonymized, captured for research, Western and Chinese medicine of the entire country, and leading research with significant proportion of top global academics in all disciplines within our disciplines. These would be some interesting goals for us to go for, right? So there's a reason why I've laid these out. You're going to find out at the end. But I just want you to have a think about those and how what we're going to talk about today might lead to us being able to achieve these really, ambitious aims. And really, in the end, I'm going to be asking you to ask more of your representative body, ask more of your professional association. Is it lacking any of the components of this kind of regulation? And if it does, it can't call itself a regulator. And if it can't call itself a regulator, you can't project that trust. And then all of the benefits we're going to talk about and all of our future plans and all of this sustaining of our tradition, it goes away. And so that's the real key point I want to make today. And we're going to talk about all the different benefits. If we don't have this, we don't get these benefits. We'll talk about what those are later. You'll see as they come along. So the identity that comes with a membership is what I would call a deep value. It's a deep value of membership. It's not just a benefit that's kind of fleeting. It's something that is there innate within us. But it has to be proven. So how do we build this? So this is a way of representing all the different layers that we have to build up, we have to do to build this trust. And you need all of them. So the trust starts with us in the middle, members. As I say, everybody in the BAcC, by definition, is voluntarily adhering to our high standards. So there's already something about us which is innate in us, but we need to be able to show that. We need to be able to show that we're well trained, we're safe, and we're professional and ethical. So how do we do this? Well, the first layer is the voluntary regulation. So we want to do things to prove that we have that regulation. So you can broadly say it splits into education, safe practice, and ethical practice. So how do we demonstrate the trust in education? Well, I think quite obviously we'll start with the British Acupuncture Accreditation Board, which is wholly funded by the BAcC in terms of the organization. It's part funded by each of the colleges, but the largest share comes from the BAcC. And that means it comes from your fees. You fund it. We also have admissions. So in the British Acupuncture Council, quite a bit of our resources is devoted to making sure only the people who meet those standards come in. And if we don't do that, we can't say that the people who are in the organization hold those. Sounds pretty self-evident, but you have to understand this is one of those invisible bits of an organization, because an organization from the outside might look like or might claim that it's doing that work, but if it doesn't devote the resources to it, it's not. And it takes quite a bit of resource. So if an organization doesn't have any paid staff, for example, they may not be doing it. Also we have a CPD requirement. So we have an ongoing commitment to education as well. And these standards that we're holding ourselves to, they were developed by us. They were developed by our predecessors. And even though these codes might not look very interesting, they are actually fantastic documents. They define everything about what is important to acupuncture for us, but also matching it to the outside world, so the outside world can understand the seriousness of the way that we take this medicine. And it is a medicine, you know, we call it complementary medicine in some contexts, but it's not. It's a mainstream medicine. And so these standards, these are some of the standards you'll find in these documents about competency, about our values, and about the standards of practice. And I highlight them here because this is you. This is what you have as a member, what you're able to project all of these things to the world. And this question of what level is our education? So the level that's been decided and over a number of years is this level 6. It's level 6 on the frameworks for higher education qualifications published by the Quality Assurance Agency. So this is a level that's chosen for a specific reason. So there are some other kinds of frameworks which more map onto something specifically technical and map out a technical aspect of something we do, but it doesn't really help with a serious medical profession. Because in a serious medical profession, we need critical thinking. We need to be able to practically apply our thinking. We need to be reflective. We need to be able to understand the latest research. And it also needs to be a recognizable standard with medical credibility that's equivalent to other regulated health professionals. And this is where that standard comes from. It also needs to be something that actually has a solid foundation for our future too. Now, it might be a little bit strange to highlight our codes. Again, I don't want to go on about the codes, but they are amazing documents. The amount of time that's been put into them and the amount of intelligence, the amount of dedication, and your fees, because they take money to create. They take time. They take staff time, which means they take money. And they've been developed over a large number of years. And they're something that they kind of form the core of this regulatory activity. And without them, the regulatory activity can't really take place. And you're going to see what we get from that regulation. And in some situations, it might be that another organization will take the codes and use them. But not only does that represent something that has been invested in by this organization, but also if you haven't created them, it's quite doubtful that you'll actually have the infrastructure and the knowledge to maintain them because they're living documents. So the other thing about these documents is we think of them as things that regulate us, but actually one of the most important aspects of these is they keep you safe and keep you protected. Because as we know, going into clinical encounters, we have a lot of exposure in different areas. There's a lot of difficult things to navigate. And these codes help keep us on the rails so that if in a rare situation a complaint is made, we're actually in a very protected position. So they're really designed to support members. And they support members in safe practice and ethical practice. And so in similar ways, our safe practice is also taught to us at our colleges. So it's accredited with the BArB. When we come into the organization, we already expected to be trained in certain aspects of safe practice, like clean needle technique and so on. And then we have our code and guide to safe practice. We have our ongoing CPD requirement. And then as with every single organization that is a regulated health professional, we have a professional conduct process. We'll go into that a little bit later. And then it's the same for ethical practice. Again, we are taught in our colleges how to navigate patient care, and this is incredibly important, actually. Possibly one of the most important aspects of becoming a trusted healthcare professional that, say, the NHS might have confidence in placing you in different clinical situations. So, again, taught to us in our colleges, we have our code of professional conduct, we have an ongoing CPD requirement. And again, the whole process is tied up by having an independent and fair professional conduct process so that from the outside world, they can have trust that only people who meet those standards are in our organizations. Only the ones that meet the standards are admitted in. And if there is a serious enough complaint that person is proven not to be able to meet those standards, then they can't remain in the organization either. And these are just basic standards. So that's really the essence of professional conduct. And I know it's not necessarily the most popular thing, but it's absolutely necessary for us to tie up this loop. And quite frankly, there are very, very rare occasions when there should be someone in our community who shouldn't be in our community for various reasons. So this is something which has to take place. It's a necessary part of regulation. It's equivalent with all other high standards bodies. There's independence and fairness throughout, but most importantly, I think this is something that's quite overlooked by a lot of our members, is that it's overseen by you. It's overseen by you, the member. And that's in two ways. One is that members are actually sit on investigating panels, and they sit in as part of the panel to adjudicate the process. And secondly, members run the organization. Members are at the top of the governance chain, and we'll talk about that in a moment. Okay, so we have our voluntary regulation. That's a little whistle-stop tour of a voluntary regulation. But something very important, another layer has to happen for this to work, and that is member support. So we have our voluntary regulation, but really the core of what the BAcC, because it's run by members and it's for members. So we want to support members so that they can work safely and ethically, and they can have a very successful practice. Ideally, not get into any trouble, but complaints happen. If complaints happen, if they follow the procedures, they'll come through those complaints in with in a very safe and supported way. So what support do we give? Of course, we give our training. We've got all of our guidance in our codes, but we give extensive free CPD. And quite importantly, this is really a key thing about the BAcC, we have a real-time support. You can phone us up. You can ask us for advice, and we can refer you to our different departments: safe practice, research and policy, professional conduct. We've got a legal helpline, which comes in under your insurance. We have our mentoring and supervision. And then we have a dedicated safe practice officer who you can report adverse incidents to. And also they can organize confidential practitioner support from other members for you. And then even more than that, because of the responsible actions of the BAcC, everything that all of the problems that get flagged to us, either from adverse incidents or from professional conduct department or from information from the latest research, all of those problems then get fed right back to you. So if we say, look, there's a lot of issues with moxa burns, for example, and that's something that's coming up a lot, we will give specific training back to members to help them to avoid those kind of scenarios. So there's this constant feedback loop where the regulation is also support, and actually the best kind of regulation is support. Okay, well, we're still not there because I could say I'm doing all this wonderful regulation. I could even have some nice shiny codes. But how can the public actually trust it's being done? Because I could have those codes, but am I adhering to them? Am I, as the CEO, just letting in all my mates and just not letting in people I don't like? Well, that's where this comes in. That's where governance comes in. So with governance, you get oversight, and the oversight is you, the member. So how does that work? Well, you're at the top in the governance structure. Underneath you is the governing board. You elect the governing board to represent your interests, and you hold them to account. The governing board holds me to account, and I hold the staff to the account. And that's so we're at the bottom of the chain, you're at the top. And then that provides good oversight on everything working. And you don't have governance without this good oversight. And then the other way, everyone reports upwards. Staff report to me, I report to the board, and the board reports to you at the AGM, which is why it's really important that people do come to the AGM, because the AGM is there for you as members to provide oversight, for us to project trust out in the world, and ultimately you're in control. So, we'll find more and more ways for members to actually have those forums to feedback and to have that control. So that is a complete voluntary regulatory structure, and that's actually how the BAcC existed for the first years of its existence up until 2013. And it still projects trust. Some of the early studies, like the Hugh Macpherson study in 2004, was done with about 680 members, BAcC members, exclusively BAcC members, and they were trusted because they had this structure. They didn't have anything else. But there is another layer. And this layer comes because, as many of us know, there were bids for statutory regulation, which means the government officially regulates us. So all those regulatory aspects go out to the government regulates us. And the advantage of that would be that you get a protection of the title. Not everyone can call themselves acupuncturists. We get a lot more standardization. Supposedly, the idea will be get a lot more benefits. We'll get a lot more integration into healthcare. Now, that didn't happen. Unfortunately, those bids failed in the late 2000s. And what was offered was something else, which is this independent accreditation by the Professional Standards Authority. And what does that mean? So the Professional Standards Authority don't regulate us. They accredit our level of regulation. So effectively, they say, are you regulating yourself well? They'll check if all our standards are in place. And with that accreditation, it has a significant level of validation by the government that people within our organization are people who can be trusted to be in healthcare situations. So we're on this accredited registers program with the Professional Standards Authority, and that's something that we're going to be evaluating as we go forward. And here are the standards of the PSAs. They've got 9 standards, and what you'll see is that they map very closely onto what we're doing already, what we were doing before we're PSA members, and what we're doing now. But they're just doing this kind of final check. They're doing a high level check on that we are doing them. The first one's not really a standard. It's just eligibility to be on the scheme. And that means that you have to be in something that has got some level of scientific backing. And well, we do. We've got plenty of scientific backing. And again, that's come from a lot of really dedicated practitioners, a lot of BAcC members, people who started BAcC colleges. And all of this research is built up until the point where we can get on National Institute of Health and Care Excellence guidelines. And we have a dedicated research and policy officer who's constantly working in this sphere. So that's eligibility. Management is all about admissions, and it's about professional conduct as well. So it's people coming in, people going out. Standards for the registrants, that's all of our codes again. The governance is it's self-explanatory, but it's interesting that governance is a key part of this regulation. So it's something that you really need, otherwise you can't call yourself a regulator. And then we've got complaints. So we've got our professional conduct department. We have to manage them in an independent and fair way. We have education and training. So there we've got the British Acupuncture Accreditation Board. Management of risk. So we have our safe practice officer, and we also have governance. Governance also looks at risk too. And then we have communication. So it's interesting that communication is one key part of regulation. So we're talking about feeding back all of the high risk things that are coming through, which isn't, to be honest, acupuncture is not considered high risk, but the complaints that we get through more than others, they're fed back through into our CPD program. They're fed back through to the colleges. They're fed back through to all layers of membership, so they know that these are things that should be looked out for. And then there's the EDI, which again tends to be a kind of governance or practice issue. So we meet all of those, and because we meet all of those, you get to use the logo yourself. Actually, the BAcC gets to use on our website, but the Professional Standards Authority are very keen that our members themselves are actually able to use the logo. And to now having the BAcC logo and the PSA logo starts to mean something. And what does it mean? What reputational benefit do we get for doing all of this, for this proven trust status? So this is a kind of a cloud of different organizations. They all have some kind of relationship with the BAcC, and this is just a small list. So this is just ones and some of these are just representing a larger group in each situation. And we have relationships with and recognition very often from all these bodies because of our dedication to high standards of regulation. So in the top right-hand corner, you have academia, you have the British Acupuncture Accreditation Board in the middle, and then you have our 6 accredited colleges around the outside. And then around the outside of that, we've got universities. So because of these relationships and because of the regulation, we are able to forge connections with universities, and we're also able to have really good relationships with lead researchers who are in those universities, some of them BAcC members themselves, or some of them just friendly to us, who are part of this research network. In the bottom right-hand corner, I've called it complementary advocacy, the Integrated Medicine Alliance, the College of Medicine, and conferences like the Integrated and Personalized Medicine Conference. And I've saved the King's Circle because the King is, in a low-key way, a very big advocate of complementary medicine, particularly acupuncture and herbal medicine. And he can't be too overt in his support. So there are various organizations can be a little bit more overt that are somewhat linked to him. Next to that, you've got the UK herbal sector, and I'll put that in because the BAcC and RCHM have this close link. Half the RCHM members are dual members with the BAcC, and there's a common ethic in the sense that we're the two that hold those high standards, and because of that, the RCHM also has its links into big global institutions like Q and government institutions like the MHRA. So through those networks, we actually have connections into government in a different route. Then at the bottom, we've got patient advocacy. Lots and lots of patient advocacy organizations, charities, and groups that refer directly to the British Acupuncture Council. So all the ones listed here either have direct referral links to the British Acupuncture Council for acupuncture, or they'll say something like use a Professional Standards Authority accredited body for acupuncture, which is us, basically. And then there's the private healthcare insurers. I've just put the Association of British Insurers there, that the Professional Standards Authority meets with a couple of times a year to lobby them to get more of the accredited registers on private health insurers. So they do that work for us. And I've put BUPA there because I'll show you the wording later on. We're not on the we're on the BUPA cash plans, but like to be on more BUPA plans, and we're lobbying at the moment. But just to show you some of the wording you'll see in BUPA, which relates to us, and it comes again from our relationship with the PSA. At the top left, the NHS, we get the NHS link to our website. The GMC, General Medical Council, recommends that GPs can refer to Professional Standards Authority accredited registers. So they permit that referral. We're going to talk a bit about primary care networks and NHS employers as we go forward too. And then the bottom left, we've got the UK acupuncture sector with all the other organizations, the ones that either hold high standards or have a high proportion of people who've got high standards in them. So we do work with those. And again, they all tend to work with us only. And so in the top, the global institutions, WHO, ETCMA, and WFAS, all the acronyms. So just as a stronger visual representation of that, what this gives us is we get in the room. So with all of these bodies, just going back, we are able to be in the room with those conversations, making sure that traditional acupuncture is in the conversation. And why is that important? Well, that's important because if you ask around, everybody you know has either had acupuncture or they know someone who has. Acupuncture is everywhere. When you speak to people, all walks of life, they kind of have this sense that acupuncture is something normal that everyone should have. So acupuncture is going places. The question is will traditional acupuncture be part of that conversation? And the only way that we have traditional acupuncture being part of that conversation, which obviously we passionately feel it should be the main part of that conversation, is to hold these high standards, hold this standard of regulation so that we can be in the room. And doing our high standards of regulation and being a PSA member gets us in the room. And I'll give you a few examples. So these are pictures I've just taken literally in the last 2 weeks. Top left, this is an upcoming podcast I've done, the new Cultivating Tradition podcast with Dr. Yen, who is the dean of Taiwan's largest Chinese medical university. In the center, you'll see Helen and Hannah representing RCHM and BAcC respectively at the ATCM 30th anniversary. So you can see the three high standards bodies with high standards practitioners in them coming together. Top right on the left, there's Yaya Maimon, is the president of the ETCMA. And on the right, it's the head of traditional medicines at the WHO. And on the bottom left, you can see me sitting next to the head of the traditional medicines at WHO, and also the lifelong president of the World Federation of Acupuncture Moxibustion Societies, which is one of those large global organizations that connect acupuncture together. And in the bottom right, this is actually a lineup of some of the most prominent and important researchers in the UK, China, and Taiwan currently today. So that's quite an important stage there, that lineup. We get to have relationships with them because of our standards. And these are not just some pictures to say some of the places I've been in the last couple of weeks. I'm your representative. I'm only in these places because of the work that you do and of the work and or the dedication building what we have as successive generations that came before me. And because of that, we can have these connections and we can have a bright future. And we're going to look at what that bright future is. Again, just to underline it, the Professional Standards Authority, they run regular meetings on lots of different subjects. I was invited to this Welsh meeting. You can see there I'm at the top, Chief Executive, British Acupuncture Council. This is who is in the room. So, and there's no other complementary medicine body in that room. It's just me. In the beginning of the meeting, they went around asking everyone to introduce themselves. And I was kind of the interesting person in the room because I was from the British Acupuncture Council. But then you've got the Chief Pharmaceutical Officer of Wales. You've got senior lecturers. You've got directors in nursing, Director of People in Public Health Wales, Associate Director of Nursing at Royal College of Nursing. These are the great and the good in the NHS. And we are in the room. And it's not just us being in the room, it's traditional acupuncture. If we are not in the room as traditional acupuncturists, who will be in the room? It will be the medical acupuncturists and it will be the physios, right? Not to say that we can't have great collaborations with the medical acupuncturists and the physios, which we do, But they're not going to push for traditional acupuncture. We are. So we need to be in there, and this gets us in there. So I think this just really underlines some of the importance of the PSA. So that's one aspect of the PSA, but what tangible benefits does it give us, right? So when the rubber hits the road, what do we actually get? Well, I've already shown you that NHS website link. And I've already talked about the General Medical Council. This is the line in the General Medical Council which tells us, which permits GPs to refer to us. So we get those referrals, and those referrals come to us. We also get, and then once people are referred, they might claim on their private health insurance, and the BAcC through this trust gets the highest range of private health insurers. And you can see there on the BEPA that we'll pay cash back towards treatment or services provided by an acupuncturist. And then the acupuncturist is defined as British Acupuncture Council member, a BMAS member, or an AACP member. Now, we should be on that list. We are on that list. Again, getting traditional acupuncture. If we're not on that list, traditional acupuncture is not out there. So it's just another thing that underlines the importance of all of this regulatory activity. Even more than that, NHS employers are specifically told that they can employ members of accredited registers and the Professional Standards Authority. And there's some examples of that, which you're going to see in the upcoming NHS Integration Month, which you'll hear from a project that was set up in a primary care network with Fleur, Jenny, and Wendy. And this project was set up because of the reputation of the BAcC, because of that it was accredited by the Professional Standards Authority. It wouldn't have happened with either of those two things, you'll find out. And because of the openings in the primary care network, and also because of the really fantastic qualities of Fleur, Jenny, and Wendy, who made it work as well. So you'll hear about that on 6th of November. On 13th of November, Ian and I are going to lay out a really exciting developing strategy for NHS integration, because some of it will be touched on today, but all of these things coming together at exactly the right moment, there's a lot of potential, and we have to discuss what the implications of that potential are. And then on 20th November, we're going to have a conversation with all of us in our community, because whether people have set up projects with BAcC help or not, we've got lots and lots of members who have set up their own projects in the NHS, work for years and years in the NHS. And we'd like to have everyone come together and discuss and develop this strategy together, because as a group, we can hopefully meet the great opportunity, but also the great challenges that comes with moving into in the NHS for the people who want to. Research is a tangible benefit. So I put John Quill's study here. This is John Quill's article, but it was a collaboration. It was part funded by the BAcC and also University of Southampton. But it was also supported quite actively by the Professional Standards Authority that gave some kind of in-kind donations to help it make it work. And this is actually incredibly important research. I keep highlighting it because the lifestyle change could be a big part of the picture that unlocks a lot of opportunities for us. So we're definitely going to be trying to use this as part of an overall picture in our strategy. And there's kind of works in progress that the PSA have worked on over time. They've been lobbying for the Association of British Health Insurers with various degrees of success, but they continue to meet with them, and we continue to lobby, continue to make the case. There's a possibility that we could get VAT exemption for us. The other health professionals have VAT exemption, and they're actively lobbying for this. It's definitely not dead as a possibility. And you know, the current head of accreditation, he's cautiously optimistic. He thinks he can make the case. So watch this space, but we'll see how it develops. But it's happening at the PSA level. And if we get it, it will only be for PSA accredited professionals. It will be massive for us. It will mean people will be able to genuinely build vibrant businesses that make them good money. There's the blood donation issue. I won't go into all the details, but the PSA have been engaged in that. Welsh licensing, we did a dedicated direct on that. And then COVID was a little disappointing, what the PSA did for us, in honesty. So I want it to be an honest evaluation of the PSA. But we also have to understand that the PSA are one voice within healthcare, and they have to advocate and they have to promote themselves. And so the PSA have, we've had some interesting meetings. I'm meeting with the CEO and the director of comms there, and they think that we can have kind of a joined up strategy where we can help each other promote the validity of the accredited registers. And one thing I would say is I went to a Westminster Health Forum meeting a couple of weeks ago on the workforce crisis. This was a meeting organized by the government and the NHS, where everybody comes together and tries to figure out what we're going to do with the lack of personnel and the demoralization within the NHS. And there were only two keynote speakers in this half-day meeting. One of them was the CEO of the PSA. And so two of them had half-hour slots. He had a half-hour slot. He dedicated his entire half-hour slot to saying that the accredited registers in the PSA should be the solution to the NHS workforce crisis. So this is something that on their own back, they are pushing. And if you might have seen in the news recently that there is the scandal amongst the psychotherapists and people saying, oh, psychotherapists are unregulated and that's causing problems. If you read down to the end of the article, you'll see the government quote, the government response is, use the Professional Standards Authority accredited registers. So this is their solution. And so it's coming at a time right now, which is quite exciting. As I say, look, if we evaluate the PSA, they clearly give us this trusted reputation. They give us connections in the UK and around the world. They get us in the room to promote traditional acupuncture, and it does deliver real tangible benefits. And this is something that, I questioned when I came in because I heard varying things about the PSA, but I think you can see that there is a lot of real benefit that we have already received. So what does the future hold? What will happen with our relationship with the PSA, and is it a good part of our strategy? Well, just to wind back a little bit, and presentation's almost over, but to wind back a little bit, I just want to say that to understand what our future with the PSA is, it's helpful for us to understand how the PSA came into being. And there's fundamentally three narratives. The first narrative is our narrative, how it appears to us. And from our perspective, this is how it generally goes, is that we had this failed bid for statutory regulation and a charter. We were offered accreditation by the PSA as a different option so accreditation of voluntary regulation. And the BAcC became a founding member in 2013. So that's our narrative, and that's important to know, right? So that's our motivation. But why did the government create it? Because it was for different reasons. So the government's road to the PSA was slightly different. The first narrative is that forget about unregulated sector, in the regulated sector, that's the regulated professions, everything from doctors to surgeons to GPs to nurses. There were successive failures in healthcare regulation. There were failings in children's heart conditions. There was Harold Shipman's crimes, and there was a scandal in Mid Staffordshire NHS Foundation. All of these things led to more legislation, eventually led to the Professional Standards Authority for Health and Social Care. Now, why? Why did they make this? So this is something a lot of people don't understand. The Professional Standards Authority for Health and Social Care does two things. It accredits and regulates the regulators, the main regulators, and it also has the accredited register scheme for unregulated professionals, which we're on. It does both, has two remits. So what you'll see is that it regulates or oversees, let's say, 10 bodies. General Medical Council, General Pharmaceutical Council, the HCPC, the General Optical Council. So it's really the large majority of the whole regulated health sector that the PSA oversees. This is a quote from their from the reason why they made it in the first place. They said that there are 20 different regulatory agencies overseeing health and care. Each new organization, each new regulatory invention has been created in response to a specific stimuli without the benefit of an overarching design, a controlling intelligence, or a coherent set of principles. So that's why the PSA was created, to make regulated bodies work better. And because they're the experts in regulation, they were given the accredited register scheme, the unregulated bodies, to accredit to. But the upshot of it is that when they have a meeting, all of those people are in the room, plus me. So we get to interact with all of these people. So as I say, the second part of the road to the PSA was the change in direction from what the government was doing. They were doing statutory regulation, they did statutory regulation of the physios, of the osteos, and the chiros, and then did a bit of a U-turn, and they changed and they said, no, we're not going to do that anymore. It costs too much money. It's too much hassle. That we're going to start accrediting the voluntary regulation of those professionals, and that's what the PSA did. So this is what it was, and this is the report. They said they wanted a system of assured voluntary registration is a more proportionate way of balancing desire to drive up the quality of the workforce with the coalition government's intention to avoid introducing regulation with its associated costs wherever possible. Interestingly, it mentions workforce. So we are thought of within the context of the workforce crisis being in an accredited register. And just for time, I won't go through all of these because I'm going to summarize them on the next page. But in this report, in Rethinking Regulation by the PSA, identified all of these structural problems within healthcare, saying specifically that the accredited registers can help with these problems. So things like aging population and workforce crisis. So this, in summary, is what the UK environment is. We've got this NHS workforce crisis. We have an aging population. We have an increase in chronic disease, and we have a mental health crisis. There are continuing concerns in the unregulated sector, just like this article that came up with the psychotherapists. But at the same time, we've got this increased recognition of the accredited registers, and we've got decentralized decision-making within the NHS. That means they're pushing down the decisions for commissioning from the top right down to the bottom level, the primary care networks, which means the possibilities are opening up for new kinds of services. And because of that, we're taking that opportunity. So Ian, plus some other stakeholders in our membership, and also in the primary care network in Gloucester, have helped us to develop this primary care network toolkit. And we'll be talking about this a lot more as we're going forward. But we're talking about how we can use this whole tied up strategy, Professional Standards Authority, BAcC's good standards of regulation, good reputation, and the possibility for NHS commissioning. And we can actually start to, and also our high quality research, putting it all together, and we can start to really maybe push things forward in a new phase in acupuncture. And that's what we'll be laying out in our strategy meeting in November, the NHS Integration Month. So yes, these are what's coming up, NHS Integration Month. Already gone through those, but please do come along, sign up and come along. So we started here, right? At this perfect vision of the future, what we could have. Well, I don't know, it might surprise you to know that this exists. In fact, that's a real place in Taiwan. That's Taichung Chinese Medical University, that picture. And the building that looks a bit like a ship on the left is a Chinese medicine hospital. And then you have the other buildings are kind of like the university buildings, right? And it's actually, the campus is even way bigger than this. It's huge. All of those things exist in Taiwan right now. Taiwan's quite an interesting place right now. We just had a presentation by the Dean of the China Medical University. So I thought, why don't we hear it from him himself? This is a clip from an upcoming video that I've done with him, which is actually part of our brand new podcast, which we are going to be announcing on Friday. So we're bi-weekly podcast that's going out.
The final question I wanted to ask you is that Taiwan has such a well-developed Chinese medicine sector, and it wasn't always that way. It's got better over time, I understand. It's not just because Chinese medicine is part of Taiwanese culture. People had to work to make these frameworks, to make it as professional as it is and accepted. In many ways, the situation in the UK is still in its infancy. Do you have any advice for us on what are the important things that we need to focus on to move forward and gain that professionalization, that level of development that Taiwan has?
Yeah, I think there are a couple of things that are very important to be able to achieve the status that we have nowadays. The first thing is that you need to have a high quality education and also good postgraduate clinical training. Then you also need to do research. With the support of this kind of evidence, you will be able to go to the next step, which is even more important for the whole TCM industry, is the regulation. So if you can provide the good quality research evidence, you can also persuade the government, persuade the stakeholders to invest more in this field.
I think it's
So you can hear the rest of that conversation on our podcast that's coming up. But it's just really interesting. This is not just someone random who's giving their opinion. This is someone who's instrumental in building something unbelievably exciting and incredible. He built probably one of the leading research centers in the world in Taiwan in Chinese medicine. And this is his answer: education. It was standards, regulation, and research. And so this is the full argument of what I'm trying to get across today is that having this is incredibly important, and understanding end to end that our regulation or the activity that the BAcC does and maintains is vital for us to get everything else that we want to actually move forward into a world where we can have a really great supported future as practitioners, but more importantly, the healthcare is getting out to all the people that need it at whatever income level. So just in summary, as I say, ask more of your representative body. Does it have these regulatory layers? And if it doesn't, it's not a regulator. It's a club, which is okay. It's fine to be a member of a club, but it's not going to push things forward, and it's not going to maintain what we've built from where we come from. And we don't get to have all these benefits. So I hope you found that a useful look at the way that trust is created in the BAcC, and maybe also a little bit exciting and inspiring about what we might be able to achieve. But do look out for the upcoming directs. There'll be the NHS integration ones coming up in November, a COVID one coming up in December, and then new ones to be announced coming up next year.